My research concerns the developmental origins of health and disease. That's really how early human life, actually when we're fetuses, embryos, and possibly even before conception, affects the risk of non-communicable diseases, chronic diseases such as diabetes, heart disease, lung disease, and some forms of cancer throughout the rest of our lives. So of course our research is very much aimed at trying to understand the mechanisms of that process. These diseases account for 60% of the deaths globally every year, so it's a huge problem. So we need to understand why and how they happen, and then of course we need to work towards preventing these diseases, which means improving health of individuals, families and societies, especially in early life. And that's really where working with NGOs, social society organisations and governments really comes into my work. Translating our research to inform policy has meant working with a range of organisations over the years. Civil society organisations such as the Non-Communicable Disease Alliance, which actually brings together a range of organisations preventing many diseases actually across the world. It's meant working with professional organisations for clinicians such as the Federation of Obstetricians and Gynecologists and the International Organisation for Paediatricians. And it's meant working with the World Health Organization, both in their European office and in Geneva in their head office. And I've worked with the former Director General of the World Health Organization, Dr. Margaret Chan, on her commission to end childhood obesity, and with two of the Assistant Directors General, Dr. Flavio Bustreo and Dr. Maria Nera, in women and children's health and in the effects of the environment on early development and how that leads to later risk of disease. Then of course it's meant working with regional and national governments, and in the UK that's meant working with the government in England, in Scotland and in Wales. Largely with the Department of Health, but also to a degree with the Department for Education. Always trying to help use the evidence that we have in a balanced and objective way to help inform policy. And I think that's really the area where the public policy unit in the University of Southampton has been most helpful. They have a network of contacts which have allowed me and my colleagues to link to the appropriate person in an organisation, because as ever, it's not what you know, it's who you know that is so important. And actually they've helped us to train one another and to rehearse our ideas to make the translation of our research into policy just that much more effective. Several things I think that I've learnt over the years, partly from mistakes, but also from some successes. I think the first thing is to assemble the facts and the information that you want to communicate as objectively and as simply as you can, and then rehearse it. Just talk to members of your research group, of your department, and also of course members of the policy unit here, to try to practice how you're going to communicate that message across to individuals who of course are not specialists in your subject. So however enthusiastic you are about your work, you have to be able to simplify it and convey the enthusiasm, but it can't be at an academic level. I think the second thing is that you mustn't overclaim. As academics, we always tend to get carried away and start to roll along down a path which seems to suggest that the work we're doing is just the most important thing, it's going to save the world, it really is the only thing that the policymakers should be listening to. Of course, that's not true, and so if you overclaim the impact of your work and its importance, you start to lose attention and you start to lose that very impact. The third thing probably would be that you must be absolutely honest about what you know and what you don't know. Once again, as academics, we're often a bit embarrassed about admitting that there are limits to our knowledge. Or if we do talk about those limits, it's always, or very often, couched in the terms of, oh, well, we need to do more research and we need more money to do that research. That's not usually the message that the policymakers want to hear, because they know very well that there are organisations that provide research funding and you should talk to them. If you're talking to the policymakers, you're talking about how your evidence should inform policy.